Oh, I would like to share with you a little bit about our presenter today. Dr. Angelica Baltazar is a strategic advisor and systems change expert with over 20 plus years of experience at the intersection of health, policy, and cross-sector collaboration. With a doctorate in organizational leadership and a master of social work, she brings deep expertise in strategic planning, data-driven decision-making, and community engagement. She is passionate about advancing equity, building partnerships, and centering the wisdom of community in sustainable, mission-driven solutions. So please welcome Dr. Angelica Baltazar.
Hello, everyone. Welcome. Let me see if we go down to our screen here. I wanted to thank you so much for joining me today. This session is part of your ongoing learning collaborative, but I love working with people that are boots on the ground. And I've heard a little bit about the birth work that you do, and I'm very excited to be a part of it. And so I'm looking forward to this conversation today because this topic is something that we are all navigating privately, professionally, and in public. And so we're going to explore how to look at grant writing as it evolves and what some are calling a post-inclusion era. Sorry, I think I'm hearing a little bit of an echo, so I'm not sure anyone's not muted, but if you wouldn't mind, that would be great. Thank you so much. I want to going to talk about words that somehow feel a little uncomfortable now because they used to be very routine. And some of the words that we're using are now considered politically sensitive or even discouraged by some of our funders. So I want to use this session and really have you engage and share and suggest and just talk about the things that are happening. Because this session is not about abandoning your values, it's about protecting them. So my goal today is to help you find language that protects your mission, that honors the communities you serve, and still aligns with your diverse funder expectations. So to get us started, I'd like to start with a quick word cloud. And so when we said we wanted to get you engaged, really do. I am hoping that each of you will pull out your cell phone or go online. The cell phone QR code is so much easier and just works a lot quicker. And if you go on, you're going to see a prompt that asks what word has gotten you in trouble this year. So these are words that could be funders have flagged them, reviewers have questioned them, or just something you found yourself rewriting. And that's the one that I get stuck on. I write something down, I'm like, oh, I'm not sure if that's right. I type it again, and oh, if it starts to feel uncomfortable, gives you a little angst, those are the words we're talking about. Now, your responses are anonymous. I'm the only one right now that's seeing this word cloud. This is really for me to get an idea of what you're seeing and what's made you feel uncomfortable. So be honest, and you can be even a little playful if you like. So I'm looking down here at my word cloud, and yes, you are. I'm seeing a lot of friends here, as I call them, words that we've known that we've gotten very warm and comfy with. Words like equity, disparity, diversity, immigration, Black, inclusion. Yes, these words have become surprisingly complicated, not just for us, but for some of our funders. And what this is telling us is that you are not alone. So I would like to do one more thing. I'm going to see if I can see all of you on the chat right here. It kind of goes back and forth for me. I would love for you to pull up just your hands, just really easy, or use the react buttons if that's easier for you. And I want to give you a couple terms, and I'd love to hear, see how many of you have had to adjust these things in your proposals lately. For example, how many of you have had to remove the word equity from your, yes. How about replacing your population descriptors because they don't want to know it. Yes, very much. How about shifting your community voice and talking about engagement metrics? Okay. Adding more data in order to avoid any type of value statements. Okay, not as many. Have you had to avoid certain words completely based on your funding preference, your funder's preference? This has been a tough season, folks. Look at the hands. And lastly, I would love, and I will guarantee that everybody's hand is going to go up at one point. How many of you have had to completely rewrite sentences in a report or a funding request? Absolutely. Okay. Let me close this chat out of the way here. So we're going to do, before we move on, is I want to just say there's really been a collective shift in the funding landscape. It's not a secret. Today, we're going to explore some practical ways to move on, to adapt without compromising who you are. Let's move on here. All right. We are experiencing a language shift. And I might repeat this term a few times because this is what it really comes down to. We are adjusting the delivery. So in the last 3 years, certain terms have become highly scrutinized. Political shifts, state restrictions, foundations are having some risk aversions. This doesn't mean that the underlying work has changed. So your community is still doing the same things. You're still serving the same populations and you're advocating for structural change. You're just talking about it differently. So what this means for our communication strategies, especially in writing, is that they need to be nimble and they need to be intentional. So I want you to think of this not as censorship, but I would like to invite you into this space to think of it as translation. We're not changing the meaning, we're just adjusting the delivery. So I wanted to give you some examples. These are value neutral phrases that are grounded in data. Those are your recommended alternatives to the words that I call my friends, the warm and fuzzy words in blue that we just have known, that have been so real and speak to the truth of the work that we do. We can no longer use those terms in many of our funding platforms or relationships. So I want to give you some examples. And I'm just really curious if I could look back at all of your little faces real quick. How many of you have, let's see, have had to use some of these other terms? Just a quick react button. Oh, that's surprising. When you look at a recommended alternative term, let's say disparities, and you see these recommended alternative words, would anyone like to share how that might feel? How does that make you feel? You can come off mute or you can type it in the chat. And look real quick. Okay. Well, I want to share some of my experiences with this because I think it's very real. I come from a long line of public health, healthcare, human services, and terms like social determinants of health have been like the foundation of much of the work that I've done. And so having to shift from that and look at things like community factors or local conditions or environmental influences and not talk about the social determinants of health. Yep, it's vague. It does not zero in the root. Can I ask, and a show of hands if possible, if anybody, these words make them feel like it's inauthentic? Because in all honesty, as I've started to shift in my own terminology, that's the feeling that I got. These are words that made me feel very uncomfortable because I felt it was vague. It was, yeah, it is vague. Let's be real about it. But this is what helps you navigate through this very uncomfortable time. And so one of the ones that I find that is just so fun and vague is when you talk about diversity. I mean, truly, I was a senior diversity lead in a large hospital. That is completely scrapped, but the work that was being done still continues. It's just under the terms of workforce capacity or recruitment and retention. You know, using terms like we're strengthening the workforce capacity through this, or we're no longer looking at social determinants of health, but we're analyzing the local conditions. Well, yes, that's what we've always done. We're just calling it something a little different to satisfy other palates. So again, when you're looking at these terms, I want you to focus on how do you shift the words that you've used and make them value neutral. And sometimes it helps to ground them in data. So for full transparency, as I show you this heat map, I'm a data geek. I have a GIS background, and I used to work with cities and states all over the place, all over the world, actually. And how do you use data to tell your story? And what I have learned is that you can say so much without using words by using a map. So I thought, let's use a map to talk about this today. I'm not going to assume that everybody has used a heat map in their work, but so I'll just really quickly. The darker the color usually means the higher the density. So the darker, in this case, the red and the orange would be the darker colors. That means there's a whole lot of somebody. And for this picture, I'm going to assume that it's probably population. But when you look at all the different segments of this heat map, I'd like you to notice how much it's communicating without using any sensitive language. So when I ask you, what story does this map tell? I want you to look at it and say, okay, I see some large dense areas in the red. I see in these light blue bubbles what looks like shopping carts. So I'm going to assume that has something to do with food. My story could be fresh food, it could be a supermarket, it could be whatever, but it probably has something to do with food. And look at the distance of those shopping carts in those light blue bubbles from all of the high level dense areas. What does this say? And if you like, you can put it in the chat or you can come off mute. That would be nice and just help us learn what you think that might say. But I challenge you to use something neutral. No equity, no underserved, and no disparity. How would you speak about this map? Is there anyone that would be brave enough to come out and try? There's no wrong answers. We're all here learning together.
It looks like someone in the chat put there may be food deserts in high density areas.
Mhm. That's a really good one. You're keeping that value neutral. Anyone else?
One thing I thought of was could be maybe like access to food is limited in highly populated areas.
Very good. Again, keeps that value neutral. So you're describing an access gap. You could also look at this as a service concentration. I look at this and I wonder, well, what are these little blue bubbles about? There are these little areas. And so if I'm thinking maybe this has something to do with food, maybe the darker blue bubbles in there might be liquor stores that serve food, that say that they're corner markets because they sell limes to go with their beer. They're all over the densely populated areas, but what looks like shopping carts are really not there. And so those of us who work in this health realm, if we're talking food, we know what that means, that fresh and healthy food is not always in the neighborhoods it needs to be. And so there's different ways of saying the same thing so that we can protect the mission by still making your case effectively. And so I challenge you, if you've not used maps, you can do simple free GIS courses online or connect with another organization, partner with them, or collaborate with them. These types of examples are great ways of communicating need without using language that is no longer welcome. All right, so now I would like us to do a little work on our own. So we are going to go to a hands-on exercise. So right now, the team at DU is going to drop a Google Doc in your chat, and you can all open that up. You're going to be broken out into some even numbered groups and just have one person kind of be your scribe. And you're going to get 3 sentences or 3 sentences acting as a case study. I want you to try to do all three in your time together, but I want you to read each sentence one at a time because this is real language pulled out of perinatal and birth work language. I want you to identify some terms or that would be flagged, things like equity, disparities, uh, marginalized, justice involved, anything that would be pulled. And then I want you to work together, like have a conversation about these terms and rewrite them using neutral language, outcome-based phrasing. Shift towards things like higher risk indicators or documented access gaps or identified through public health data. You can be as creative as you want. If it's the first time you've had to do it, it's a little difficult. And that's why I'd like people to work together because I think we learn best when we learn from each other, especially when we're all working in the same world. So the goal is to keep maintain the intent, to keep your same population, your outcome, and your purpose. So here are the three. Again, I'd love you to try all three. If you only get through to two, that's great. I want to give you at least 10 minutes to work collaboratively together and kind of come up with things that you think would work.
Okay, Dr. Baltazar, would you like me to open up the rooms?
Yes, please.
Okay, I will open those now.
You'll see this is a shared Google Doc, and so there will only be a couple of your scribes, one from each breakout group, that is going to document your rewrites on the document. Oh, welcome back, everyone. I'm gonna let everybody popcorn in. Okay. It was so fun popping into your breakout rooms and kind of seeing the faces and hearing a little of the discussion. It was cute. There was some like, oh, little grimaces. Others, I walked in, I don't recall which breakout group it was. We need to ask her. And I'm like, her is here. I really do. I love working with small groups. It's a lot of fun. So I would love to hear from you, as I shared in our little pop-ins. If you don't mind, if I can, if there's a brave breakout group that wants to go first, or I can just kind of go in order, I would love to hear from you. You don't have to share every rewrite, but just pick one. It could be one that you were like, yeah, I really love this, or we really struggled with this one, and we'd love to get input from the rest of the group. Anyone would like to go first?
I'll go first if I can be done.
And which breakout group were you?
I was in breakout group 1.
Okay.
Sorry, it's charging up my laptop.
No worries.
I was in breakout group 1, and so we started off very strong, I think, and then number 3, case study 3, pretty much kind of stumped us, and it was hard to try to figure out some alternatives. So are you wanting me to go through what we actually wrote?
Yeah, go ahead and read the original sentence for everybody again, because I don't have it in front of them.
The original sentence
Or I have it right here.
Case study 1 is our doula program reduces racial disparities in maternal outcomes by providing culturally grounded support to Black and Brown birthing families. Our rewrite is our doula program reduces the gaps in outcomes among birthing families and low access communities through individualized services and comprehensive community-based care.
Very nice. If I could reach my react button, you'd get a little clap. So
okay, we'll take that. We'll take that.
There you go. You got some little hands clapping right there.
Case study 2. Original sentence was we advance breastfeeding. Anonymous rabbit. It's blocking it. Okay, equity by connecting underserved moms with culturally competent lactation support. Our rewrite is we reduce the gaps in the rates of breastfeeding women by providing high-need moms with broad-based lactation support.
Beautiful. You only have to do one. That was great.
Oh,
okay. No, that's okay. I wanted to ask you,
Sure.
What was the hardest part of these rewrites for you? or for your group?
I think it was just we questioned a lot of the words if the alternatives we were selecting were okay to use. We really got hung up on advocacy
Yeah.
as well as underserved. And we were the ones that were like, oh, can we phone a friend and it's you? Because we were questioning if underserved was, and you were like, yeah, no, basically take that out. But advocacy, I was just like, I don't know. I feel like it made me start, I don't want to speak for the group, but for me, I was just like, you know what, like, what is the current landscape? And I think anything that we were currently doing, we need to kind of pretty much scrap and start thinking in a completely new lens, which is difficult, right? Because we arrived to this work for a certain reason and for certain people, like very specific communities and people we want to serve. And so having to scrap that, it kind of feels like scrapping a part of yourself, but it's like, do you want this money or not to continue to do the work to impact those people? And I think that's more important. And so I just had to put on a different hat and say, like, if I disliked almost everything, what would I use to help me, get through this exercise?
You. One of the things we were sharing earlier is like not everyone is having this issue. Not all of you are having to say we have to change things. Many of you may have private funders that are welcoming this language and it's not an issue for them. But some of you are going to have a diverse group of funders that have state pass-through money or from the county that's saying, yes, but we get this money over here. You may not have to change everything, but you just need to be aware of how to adjust the delivery depending on your funder. And, thank goodness we're not at a point where, oh my goodness, we have to take everything off our website that says this. But if, God forbid that does happen, we know we are just adjusting our language. That's all we're doing, adjusting the delivery. All right, breakout group 2. Can I have someone that'd like to share one of their case study rewrites? Could be anyone from
Sure. We can share. I guess since we went over the first two, we'll do the third one, the case study number 3. We actually started from the third and went back up.
Right.
And so the original sentence, our organization supports marginalized birthing people by by advocating for reproductive justice and providing inclusive childbirth education. And so our group came up with our organization supports birthing people with low access by advocating for reproductive health services and comprehensive childbirth education. The pieces that we kind of went back and struggled with, yes, the wording, but also like when we're using this new language and these new words, is it still conveying what we're actually doing and the messaging around it? So that's really the piece where we kept kind of going over and over, not with this one, but just with like all 3 of them, kind of rereading them. Like, okay, is this still conveying the same sentiment of what we're doing? And then for me personally, with changing words, it's like our sentences become a little bit more clunky than they were before, not quite as streamlined. So those are the things that we were working with. But thank you to my group.
So that was the hardest part, the feeling that clunkiness. It's awkward. It's awkward. All right. Let me finish up. I think it was group 4. We didn't have a group 3. So breakout room 4. Would anyone like to share their neutral phrasing?
I can talk about some of the process that we went through for group 4.
Okay.
I think we ran out of time towards the end because we started at the beginning, but we ran out of time towards the end. And I think the third case study was probably the hardest for us. I think it's already been read out, but our organization supports marginalized birthing people by advocating for reproductive justice and providing inclusive childbirth education. So we ran out of time, but what we had so far was our organization supports birthing families by advocating for better reproductive health outcomes and providing tailored childbirth education.
Yes.
But I feel like, even the use of birthing families or reproductive health outcomes, I don't know. I guess I kind of struggle with that. One thing that we tried for some of the other case studies is instead of talking about disparities and deficits, we tried to make it more positive. So we're trying to improve health outcomes, because that doesn't specifically say that some people are better off than others, which I feel like can sometimes be a little bit triggering for some people.
Yeah.
Just the idea that some people have unequal access to services or, have unequal health outcomes. I feel like some people dispute that, right? So instead of talking about, disparities, but really, we're just trying to improve things. But I don't know if we successfully did that in the last one.
Like, thank you so much. Like I shared with all of you, there are no right or wrong answers here. This whole exercise today was, like I said, were you uncomfortable? Good. This is the place to be uncomfortable. Learn from each other, share. You might have heard somebody's term and thought, oh, we could use that. Like that's where I want you to go with it. And that's one of the reasons I want to share this document when we're all done and just PDF it, and it'll be part of the tools that we send over with DU. So I just want everyone to realize again, we know that this feels icky because it still feels icky sometimes for me. And that's okay, because that means we're human. We care about the people that we are providing services for, and we care about our team members. And if you're in this public health space, it's because you care about the health of the public. So we know we're there with you. But don't worry, because your authenticity that you're feeling kind of like this is against everything. It's your authenticity lives in your outcomes, in your relationships, in the work that you do, and not in these words. And so, like I tell people, your challenge is to strike that balance between your mission and the realities of this funding environment. So I like to say that these rewrites are not retreat, they're strategy. And so think of it like that. This is not forever. This is just a right now strategy. So I want to thank you guys. I really do. That was wonderful. So as we kind of wrap this up, I want you to look at this little prompt right here. What's the one phrase that you heard today that you'll rethink tomorrow? And if you want to drop it in the chat, or if you want to come off mute and share it, that's great. But I would love some type of response. Like, what's one thing that went, a phrase that you might rethink tomorrow? For me, this is like a personal commitment to always learn something. Like, I can try this the next time. But for today, I think it helps anchor some of the work that you're taking away with you today. Let's see. No, thank you to Micah. You're so cute. But it's true. And I think when you say it like that, it's so empowering.
I think one takeaway for me is leaning into the data, kind of guiding the language. So families identified through public health data or evidence-based X blah blah blah. Like I feel like that's one key takeaway that I will lean into more. We talk a lot about data and we want it and we use it, but like leaning more into it in the languaging, I think could be helpful and feel less disingenuous.
Maps, I'm telling you, maps are amazing, amazing tools. Not just dashboards, but real maps that can tell a story. And then you just change your language when you're telling that story, but you can't, data is real. You can't dispute. Yep, exactly. It's harder to deny the data. All right. Well, I want to thank you. Oh, here's another one. Yes, your authenticity lives in your outcomes. Those are the things. Trust me, I have calls with other friends that are in this world, whether they're consultants or providers. And sometimes we'll just connect like, oh, this is just killing me today. I just need to talk to somebody about it. And I'm sure you do the same thing. It's like, we're all in this together. We're all trying to do the good work that needs to be done. And we're just trying to adapt with the current environment. All right. So thank you, all of you, for being curious, for being creative, for engaging. I mean, if nobody talks to each other or nobody chats, like, it gets boring. Like, this is fun, and this is I learned from you guys. I love it. So thank you. Again, our goal here was not to erase your language, but I want to equip you a couple terms. I want to challenge you to get creative, protect your voice and your funding and your impact. So I will be sending some tools out with you sometime next week, I think Joshua said. But again, thank you. I really enjoyed my time here today.
Thank you so much, Dr. Baltazar. This was really, really helpful. Like, this was great. I'm waiting for the handouts myself. I have some that I want to highlight. Thank you so much. You'll see Dr. Baltazar's information will also come to you in the deck next week. I'm going to take a minute to see. I know we went right to the edge here, but does anybody have any follow-up questions for Dr. Baltazar today?
There was a question in the chat, so I'm going to lift it up kind of towards the beginning from Dr. Saida. Can you share the source of the list that people refer to the words to avoid per the feds? Oh, you're muted, Dr. Baltazar.
Sorry, the bar wasn't coming down. I'm going to do this really quickly because we only have 2 minutes. There is no official list. What people have seen have been screenshot grabs from webinars that the feds have put on or the Department of Health has put on, but nobody has released an official list. But what we've been told and what has been kind of communicated in different forums about certain words, those are the things that we're pulling out. And again, like we know anything that's equity related, it's what it is. And so I've gathered a couple different resources and I've used some from Esri in regards to data to really help you take that language and ground your work in some data. And so I have a couple different pieces that'll be part of your package. So hopefully that'll be additional resources, not just the list that we talked about today as an example.
Thank you. Thank you so much. So to close out, everyone, there is a survey. We appreciate your feedback. This is our workshop evaluation. Your feedback helps us to ground and offer you guys more, right? What was good about this? All of the things, right? Please take our survey so we can keep doing this powerful work and keep bringing things that are interesting to you and necessary for us to continue to navigate these uncharted waters. Thank you so much for your time. We'll leave this up for a few moments so you can do the survey. It's also in the chat. And yeah, thank you so much, Dr. Baltazar. I very much like your last name.
Thank you,
everyone.
Bye, everyone.